There are many desired characteristics for a suture material like easy to handle, predictable behavior in tissues, predictable tensile strength, sterile, glides through tissues easily, secure knotting ability, inexpensive, minimal tissue reaction, non-capillary, non-allergenic, non-carcinogenic. No suture has all the desired characteristics, and the ideal suture is yet to be produced. There are many different types of sutures grouped by several distinct characteristics. Understanding these characteristics allows for ideal suture selection. The main factors used to classify suture types are absorbable versus non-absorbable, synthetic versus natural, monofilament versus multifilament. The first main suture category is absorbable versus non-absorbable sutures. Sutures are considered absorbable if they lose most of their tensile strength over variable periods ranging from a few weeks to several months. Absorbable sutures are often employed for deep temporary closure until the tissues heal, or when it is not easy to remove them otherwise. In this fashion, they are useful for approximating edges of tissue layers, closing deep spaces or defects, and facilitating wound healing as part of a multi-layered closure. When used superficially, they can have more inflammation, leading to more scarring. If using absorbable sutures superficially, the recommendation is that a rapidly absorbing suture is employed. Non-absorbable sutures are used for long-term tissue closure, like vessel anastomosis, permanently ligating internal tubular structures or vessels, performing a second layer of bowel hand sawing anastomosis, hernia facial defects closure, and other uses. Natural sutures are derived from purified animal tissues, usually collagen, and are sometimes made of the purified serosa of bovine intestines. For example, catgut is made from sheep gut. Silk and catgut are examples of natural sutures. Natural sutures differ from synthetic sutures in that they degrade by proteolysis, while synthetic sutures degrade by hydrolysis. Hydrolysis causes less of an inflammatory reaction than proteolysis, which is why natural sutures can be known for causing more inflammation at the suture site. Catgut sutures can be treated with an aldehyde solution to strengthen the material called plain catgut sutures. They can undergo further treatment with chromium trioxide, which also strengthens and helps them last longer before absorption, like chromic catgut. Another important suture category is monofilament and multifilament. Monofilament sutures are single filaments, as their name implies. Monofilaments have less surface area than multifilaments. Multifilaments, as the name implies, are made up of multiple filaments. These filaments are either braided or twisted. Monofilament sutures have higher memory, which demands more handling care. Memory is the tendency of a suture to return to its original shape and makes the suture more prone to knot loosening. It should be addressed by holding the suture and slightly tugging it. They typically require more knots to ensure security, but tend to fracture less than multifilament sutures. Monofilament sutures also pass through tissues more easily and cause a less inflammatory reaction than their multifilament counterparts. Conversely, multifilament sutures are more pliable. They hold knots more securely, have less memory, and are easier to handle by the surgeon. However, multifilament sutures also cause more friction through tissue and have increased capillarity and surface area, more prone to inflammation and infection. Multifilament sutures can be coated to make them slide through tissues more easily and have properties more similar to a monofilament suture. They can also be coated with antibiotics to make them more infection resistant. However, they are more expensive than traditional sutures. Most sutures have smooth surfaces. However, there are newer sutures manufactured with barbs. These barbs help approximate wounds and do not require knots for security. Barbed sutures more evenly distribute tension along the wound. These sutures are also known to be more time efficient. Another feature, just like in needles, is the size or diameter of the thread. Sutures are numbered by their size relative to their diameter. Thick suture numbering is from 0 to 10, with number 10 being the largest diameter. Thin sutures are those that have the greatest number of zeros after them and range from 1 to 0 to 12 to 0. 12 to 0 having the least breaking strength. There is about a 0.01 to 0.05 millimeters diameter difference between sizes. This is part of the basics of suturing. Please subscribe for more videos.